Um, Dr. Julie Durnan, really excited to have this conversation with you. We've been talking for a couple of years. You've been a big supporter of Jane. You're a clinic owner, but also the founder and CEO of Ginger Desk. So Julie, I'd love to hand it over to you. You can tell us a little bit about yourself and Ginger Desk before we get into this.
Thank you, Ashley, so much. So yes, I'm a naturopathic doctor. I'm in North Vancouver, and Ashley and I actually had the honor of meeting each other in person a few years ago. And I'm a clinic owner of Restoration Health Clinic here in North Van. And we have a big clinical team at Restoration. And 2 years ago, I founded and had the aha moment of starting Ginger Desk. We're a team of virtual assistants all across Canada who are specifically trained to support health practitioners.
It's fun, Julie, we're neighbors, really. Like I'm actually just down the street from you, which is so curious too. So yeah, wonderful. We're looking forward to this session. So
Thanks, Ashley.
I'll hand it over to you.
Awesome. I will just share my screen here. Thank you so much. How's that? Is that visible there?
It is looking good.
Awesome. Thank you, Ashley. So welcome, Jane community. Thank you for having me here. I am so thrilled and honored to be here. This is how to set up your virtual office for ultimate practice success. And as Ashley just said, my name is Dr. Julie Durnan. I'm a naturopathic physician, and I'm the founder and CEO of this incredible company called Ginger Desk, virtual assistants for health practitioners. I'm also a community builder, and I'm a fierce advocate for supporting women who want to build their careers, focus on their families. And my ultimate mission is to make allied health more accessible for all. So today we are talking about the strategy, considerations, and all the specific things that you need to do to set up your virtual office. So what I'll be talking about isn't just for those folks in virtual practice, it's actually also for those people in brick and mortar clinics. So you're all welcome. This is for all of you. Anyone who wants to build efficiency into their practice and to really leverage technology to save your personal time, this is for you. So please let us know in the chat, are you a virtual practitioner? Are you in clinic, or are you hybrid? I'm so interested to see. I know you've all introduced yourselves, virtual, hybrid, and clinic. Oh, VA, yay, awesome. Love seeing the VAs on here. Hybrid, 100% virtual clinic, virtual, hybrid, sole practitioner, virtual, hybrid. Oh my goodness, so much virtual on here. Yay, 100% virtual, hybrid. Awesome, keep it coming. Are you virtual, hybrid, or in clinic? I love hearing this. This is awesome. So I am so passionate about this subject, and not just because I love all things organizing and systems related, but also because the practitioners that we see who launch virtual offices have become some of the most grateful and joyful people I know. And we're not just building offices together with practitioners, we're actually reducing burnout across the allied healthcare profession. And I know there's been a lot of talk of this already in the past 2 days at summer school. So I think this is really important, and I'll be talking on it a little bit more in this presentation. So first, there is a whole team of us supporting this talk today. I'm doing the speaking, but behind the scenes in the Q&A and also on the chat is Joanna Buskowska-McCumber, who is our Chief Operating Officer here at Ginger Desk. That is Jo there on your left with the black top in the image there. And so Jo's in the chat. She's also in the Q&A. Feel free to pop in and ask questions as you go. If there are questions that I can answer, I'll be getting to them at the very end, but our team will be there answering them as we go. We're also joined on the chat and the Q&A by the amazing Lauren Sinclair, who is in the image on your right and taller than me. And Lauren is our Director of Product and in charge of our whole team of virtual assistants. So you can say hi to everybody on the chat there, and they'll be there to answer any questions as they come up. Now, a little bit about me. I've been in practice for the past 16 years. I have focused my practice until now on women and children. I'm currently on a sabbatical from practice, but I did have a really thriving women's health and pediatric practice. I founded 2 integrative health clinics in my time. My current clinic is Restoration Health Clinic in North Vancouver, and we are super proud Jane app users and fans. And we're a team of 7 naturopathic doctors, a medical doctor, an acupuncturist, and a nutritionist. And I wanted to share a fun fact about my clinic. My clinic is actually located across the complex from a clinic called Canopy Health. And it was there that I met another fellow clinic owner and my neighbor, the amazing human that we all now know as Allison Taylor, the co-founder of Jane. So really cool to be here today and be at Jane Summer School, as my experience with Allie has just come full circle, from clinic owning neighbors to now watching and cheering her on as she launched and made Jane this massive success. And now growing Ginger Desk alongside Jane. So really awesome. Thank you, Allie. Thank you, Destin. Thank you, Ashley. And thank you, Jane App, for building this amazing community for all of us. So here is a quick overview of our discussion topics for today. We will be diving into my personal story, the birth of Ginger Desk. I can't talk about how to build an office without telling you my why and my passion for this whole plan. We'll also be talking about why the heck do you want to have a virtual or remote office anyway? And then I'll go through the checklist of considerations that I've had to learn over many, many years of hard work, failures, and now successes. And I'll also share with you the impact that Ginger Desk is making in the world, and it's likely not what you think. And then we'll open things up for Q&A for any questions that haven't been answered in the chat as we go. So the Ginger Desk story. This is one that is very, very close to my heart. In 2020, as many of you did as well, I watched my colleagues retreat from their brick and mortar clinics, and they moved home to offer telehealth to their patients. 80% of clinicians across North America at that time moved their practices to telehealth, but these clinicians were not set up for a virtual workflow. In fact, 81% of clinicians saw a drop in their revenue in 2020. Practitioners were busy, but they didn't have the time or the energy to hire an assistant to step in to help. So during this time, I sat down with one of my dear naturopathic doctor friends, and she thought this transition to virtual practice would be easy. Patients were excited to see her virtually, so she would set up a few autoresponder emails, use her Jane app for electronic medical record software, and she would handle bookings that way, send invoices between consults. She thought this would be a breeze, and she thought setting herself up to make a bundle of money at home was the way to go, that she would just completely defer all overhead from having a clinic. Now, very quickly, my colleague found herself exhausted with the admin needs of her practice. She was struggling to respond to patient inquiries. She was sending invoices in the evenings after her little kids went to bed. She was letting document filing fall through the cracks, and her patients were getting upset. She was missing new client inquiries altogether as she couldn't get back to them in time. And my colleague had to cut her patient hours virtually in half in order to handle all the admin tasks. She was then providing poor patient care, poor follow-up. She ended up burnt out, and she'd completely lost her joy and passion for her practice. My colleague needed support, but she didn't know what to do, and she didn't have the time to train someone. And this was my aha moment. What if I could hire and train people to support other brilliant and bright colleagues of mine with similar support systems that I've built over the years in my very own clinic? And then Ginger Desk is the solution. So we are now disrupting healthcare by hiring, training, and managing industry-trained medical office assistants and matching these virtual assistants to health practitioners across Canada and the US. And we call this the Ginger Way. So why the heck a virtual office? Why would you even want one? Virtual offices for both virtual practitioners and practitioners who see patients live and in person are the most effective way to save time, money, and the environment, and I'll tell you why. First of all, a virtual or remote office saves space. The actual front desk area in a busy clinic can cost you hundreds to thousands of dollars a month in lease payments. And it's so incredible to see how these practitioners that we work with have become creative with their patient load when they don't have the pain of housing someone there at the front desk. They're able to then rent that space out to another practitioner or use it for other revenue generating activities like a group program, for example. Next, and this is a huge benefit, a lot of people have overlooked this and don't realize this, but when you have an assistant working from home, they're able to dedicate a quiet space for their work. And then they work uninterrupted. They're not interrupted by patient conversations, by practitioners walking by their desk and chit-chatting, and also the talk among coworkers at the front desk. We have seen this valuable quiet space pay off in so many ways. So assistants at home are able to tear through a list of client recalls, for example. They can get through a list of emails and calls for accounts receivable and collections all in one go without having to just piecemeal it and multitask while they're trying to answer the phone and other activities. They can be hyper-focused and incredibly efficient when they're not multitasking. It's really nice to have a dedicated assistant. There's also no payroll, tax deductions, HR pains, or vacation pay when you have a virtual assistant. Did you know that it costs almost 15% on average in additional fees to have an employee instead of a contractor? So for those of you who have had staff before, you'll totally understand this. It's a huge cost, and then you've got to account for the huge pain in managing that payroll and paying the deductions each month. If you're late with deductions, as those of you know with staff, it costs a lot if you miss a payment date. So remote or virtual admins typically operate as a service, and you just pay for that service a lot like you would a contractor, and it saves a whole host of headaches in the HR department. Now, there's also no downtime when you hire a virtual team. Virtual team like ours, like Ginger Desk, bills you by the minute. So you're not paying for idle time like you do with conventional medical office staff. You're not paying for time for them to go get a tea, go to the bathroom, have their chit chat. You're just paying for what we call time on task. And also, you don't have to worry about managing your remote team member when they're outsourced. So companies like a full service company will handle all the management for you. And for those of you who have not had staff before, let me tell you that it's not just a skill to manage a team, but it's also an art. It requires you to understand negotiation and leadership skills, but also to really understand psychology and how to really work with people. You have to perform progress reviews, oversee their work, monitor their time, monitor their tasks, as well as provide like a really nice culture for them to engage in a community. And so when you hire someone and outsource them, you don't need to provide that piece. There's a company that will manage them for you. The other piece is you don't have to train a virtual assistant when you outsource. You bring on people who are already skilled in the skill set that you're looking for. They come pre-trained, ready to work immediately in the skill set that you require. This saves you hours of training time from your own billable time. And you're also paying by the task, not the day. So the overall monthly payment of a virtual assistant service can be a quarter to a third of what you might pay to hire, train, and manage conventional employees in your office. Now, I also want to highlight the digital and efficient systems that are required when you have a virtual office. Working with a virtual team really requires you to get clear on all your systems. And I'm going to talk more about systemization shortly. It requires that you also get clear on your communication and your documentation of everything. It makes you super efficient so you can run this lean team really smoothly. Now, I don't have these 2 points listed, but they are actually the most important points I want to make. One, rural access. You can practice from anywhere you like when you have a remote team. So you can be in Northern Saskatchewan, you can be in Iqaluit or Vermilion Bay, Ontario, and still get the awesome support that you might get if you lived right in the city in Vancouver or Toronto. And then there's no commuting. So less cars equal less fossil fuels. If your team gets to work from home, that is one less car that goes into the world. And now I want to talk about the benefits to your team. So what started as my mission to support my own colleagues with Ginger Desk has quickly evolved into something that I never expected, to be totally honest. Supporting women and women identifying folks who work with me as VAs at Ginger Desk has now become the absolute honor of my lifetime. Building a system that enables these women to work from home while climbing the career ladder, getting job promotions, and simultaneously nurturing their families and their personal lives this has become a dream come true. So while you consider bringing on a virtual team and building out your own virtual office, remember this. Remember how it benefits the team. First of all, they're happier. And I'm going to go into this more in the next slide. They're also more efficient and useful because they have very clear, dedicated tasks. There's also an intentional collaboration with these team members. Because you don't just walk by their desk between consults, you have to purposefully and intentionally take the time to meet with them on Zoom. You have to really intentionally send them an email, and they're going to feel that support when they get your attention in that way. You're also going to be leveraging technology and the skill set of your VA and what they've exactly wanted to do with their career. They'll feel like they're being utilized fully because their time is so well spent and that they're really in the right department. The most important thing here, and I'm going to be talking about this throughout this full hour, is that staff can build their careers while nurturing their family and their personal goals at home. I could do a whole talk on this, and I probably will one day. There's just so much to discuss and unpack here. But until now, workers had to choose between building their careers or caring for their family members and their wellness, especially medical office assistants. These people traditionally have been tied to clinics and chained to their chairs. So have any of you read, I would love to see in the chat, have any of you read Pay Up by Reshma Saujani? It just came out, I think, last year. Please let me know in the chat if you've read this. It's called Pay Up. It's such a cool book. And you'll have to click on everyone to see, to add your comment there. It's so great. If you haven't read it, please do. It's all about the future of women and work and how feminism got us only so far in the workplace. But women who manage families and households in this North American culture, we are still so unsupported by this culture and by work. So the benefit here might summarize my whole purpose and my whole vision for Ginger Desk. I'll speak more on this later so I don't get off track. And finally, rural access to jobs. Your team can now work from anywhere. Oh, I can repeat the author. Her name is Reshma. So I'm going to actually type it in the chat here. It's Reshma Saujani. There. It's called Pay Up. It's quite an incredible book. Your VA can actually work from anywhere that they want to. They'll work in your time zone, but they can be in Northern Ontario. They can be in Northern BC. They don't have to be in a big city to have just as great a job as they would have otherwise. And now here are some fun facts on employees. Did you know that only 3 out of 8 hours in a typical workday are actually productive? Who knew this? I would love in the chat for you to comment. Who knew that only 3 out of 8 hours are actually productive? And for those of you who follow like Scandinavian work ethic, you might already know this. Awesome. Awesome. That's great. Studies show that our employees are only 37.5% effective. This means that in a typical office situation, you are literally paying your employees 3 times more than you should be. When you pay by the task rather than the hour, you eliminate all idle time, chatting at the front desk, like I said before, making tea, going to the bathroom, going for a little walk. You're only paying for the time you need when you pay for time on task. And happiness. I mentioned this earlier, but here are the stats. A new study in 2022 found that remote workers are 100% happier remote workers who work 100% from home are 20% happier. In this study, by tracking happiness, they looked at 12,400 employees who were surveyed about their work conditions. And they asked the respondents, if you look at your work, how would you rate your happiness on a scale of 1 to 10? They also asked them how much they work from home. And then the key findings that were so cool, and I think you could extrapolate these rather to your clinical teams as well, not just your admin team, but really consider like if you want to have your clinical team also working virtually. The ability to work remotely increases employee happiness by as much as 20%. This is significant and this is awesome. Millennials are happiest when working remotely. Millennials represent a large portion of medical office assistants in our workforce. So this is really, really cool. And I'm sure millennials also represent a lot of our NDs, our physios, returning to office-based work after the pandemic reduces employee happiness. And some of this, like I said, can be correlated to our clinical teams. You know, since the pandemic, it might be worth considering if you want to have some of your clinical teams stay virtual permanently. Employee happiness decreases as commute time increases. So how about removing the commute altogether? You've got this happy team. And happiness at work is significantly correlated to overall life happiness. We love this. We want to work with happy people, happy clients, happy employees. It's just wonderful to have everybody enjoying their life because they love their job so much. Okay. This is what most of you have likely been waiting for. I know everybody loves a good checklist. So grab a screenshot of this slide. Here are 6 things that you need to do, to execute, to plan if you want to build an efficient virtual office and team. So I'll go through each one of them, but we'll go through leadership and values, client's perspective, college, ministry, and legal regs, the tech stack required, communications, and workflow. So please let me know as we're going if you want me to come back to this, because you might want to screenshot that now. I'll just give everyone a sec. Great. Leadership. I'm starting off with this because most people, when they think of setting up their virtual office, they right away get onto the whole to-do list of technology required. But in fact, this is by far the most important thing that you do if you want to launch a virtual practice. You need to get crystal clear on your own leadership skills and on your business's values. Poor clarity on these considerations can result in really poor dynamics for the teams and also just unruly issues in the workplace. So as Ruth Bader Ginsburg, love her, said, fight for the things you care about, but do it in a way that will lead others to join you. So go after what you want, work for it, speak about it, live it out loud, do what's right, and make it easy for other people to be inspired by your cause and your ethic so that they align with you and they support it too. And you also want to make sure you're working with the right people, and you want the people to know that they're working with the right people. So make sure you're crystal clear on your business's 3 to 5 core values. While this might not be super critical if you're in office and people get to know you every day, this is hyper critical if you're going to be working with a remote team. So whether you're solo practitioner or have a big multi-practitioner clinic, write down what's important to you, the top 3 to 5 things. Is it professionalism, integrity? Is it diversity? Write it down and share it with everybody you work with as frequently as possible. And the next thing is expectations. So what are your expectations for the role you're hiring for? You need to really sit down and have a think about that before you actually bring someone into your team. Do you want them ready for work at 7 a.m.? Or do you want them just checking in at 10 a.m.? Do you want a compassionate and warm and fuzzy person? Or do you want a type A personality who really gets stuff done? And it was really cool. Nicole McCants talked about outsourcing your admin this morning. She was on at 7 a.m. Pacific time this morning, and she talked about doing a personality assessment. And I loved her approach, and she's got a personality assessment on her website. And this is critical. You need to know who you want to hire, what these people's general personality traits are, because if you don't know, you're probably not going to end up bringing on the right team member. And then a job description. Make sure every role at your business has a job description. And this doesn't just go for admin staff. This also goes for your physio, your RMT, your naturopathic physician. Make sure that they have a job description that has an outline of what the job itself entails, the goal, the specific role, specific skill set required, and the tasks, because clinic to clinic, this will completely vary. And people assume that it's always going to be the same, but nobody's a mind reader, and every clinic has a different expectation and different role in their job description. And finally, make sure you list off all the responsibilities that this person will perform during this job and what success looks like when they've done really well. Does success look like more new patients? Is it more revenue? Is it maybe more accounts receivable collected? Do you want to get your inbox down to 0? Make sure you write down all of these goals and what success looks like for this role, because it's so critical that you repeat this then to your team. And now the client's perspective. So I hear from people all the time about their concerns from the patient's perspective. People worry, what will people think? What will my patients think when they find out my VA isn't in my office, that they're remote? Will they be open to it? And I want to remind you right now that they don't care. All they want is they want human interaction, and they want their needs to be met. And that can be done. 99% of what a virtual office assistant can do is what the person in person can do. So I love to remind people that first and foremost, a VA is a human on the other end of the phone or the email. Patients love the attention, and they love the fast response time. They don't mind that this person isn't sitting in your office. They just want the support. They want to change their appointment. They want to get a copy of all their invoices from the past year. They want to know about their direct billing query. They want it to get in last minute off the wait list. The human interaction is something that a VA can provide and really make or break a practice. And they can do this while you're seeing patients. And busy patients. So your patients are busy or possibly busier than you. They don't want to hear back from you in 72 hours that it says on your autoresponder. They don't even want to hear back the next business day. They want their answer and their booking to happen same day. So professionalism. We often hear from our new grads at Ginger Desk that they love having a VA because they love the perception of having made it. So it's so cool for them to be able to say to their patient, my assistant will get back to you later today with that invoice, or my assistant will get you that insurance form. It really invokes a feeling of trust and a feeling of being taken care of. And it reflects so well on you and your absolute professionalism and your high quality patient care. And then patient support between consults. You can't support your patients when you're busy in consults, and you shouldn't be supporting patients between consults, because you should be exercising, spending time with friends, spending time with your family, and really focusing on wellness. So let your assistant support your patients between their consults, and you go focus on your zone of genius and scaling the life of your dreams. Now, I have to have this slide in here. It's regulatory. This would not be complete if I didn't mention it. And I'm sorry that regulatory talk can be a little bit Dullsville, but we have to talk about it. We work at Ginger Desk with licensed healthcare providers, and most of Jane community, you're all licensed healthcare practitioners. So I have to remind you that province to province, state to state, country to country, obviously, but also discipline to discipline, the regulations are going to be different. So the regulations for an MD and their admin support is totally different than a psychotherapist in Toronto with their assistant than a physio in BC. So check with your college, check with what the college is required to do with your profession as per the ministry, because it's going to be very different. For example, in the US, we have practitioners that we have sign a business associate agreement. It's called the BAA. And this promises that our VAs will be HIPAA compliant. Now in Canada, that's not required. It's just not part of our regulatory thing for Health Canada. So, or for the Health Professions Act rather. So have a consideration of what's going on in your province, or if you're in the US, do you need a BAA? What's going on for your state? And then make sure that your admin staff understands that. Also make sure that your admin staff understands your specific scope. So can you prescribe medications? So for example, can you prescribe testosterone as an ND? Like in BC, we can prescribe a whole host of medications, but we don't have testosterone rights. Can you see a patient for an initial consult by video? Make sure that your admin staff knows this, because if it's illegal for you to do so and you've got to see them in person, you want your admin to be following your profession's regulations. You also, you also want to consider what having someone out of country supporting your team might mean for your privacy. So PIPEDA and HIPAA compliance, it is complex, but it can be managed when it's really well understood. So you want to just make sure that you're looking at any sort of barriers country to country and what that might involve for privacy. In terms of contacting patients, you want to consider, do you own the patient charts and are you approved to contact them? So we get people reaching out to Ginger Desk all the time who are actually working in other clinics, and the clinic owns the charts or owns the files. So you can't have your assistant contact those patients if you haven't been given approval to actually reach out to them. So make sure you have that conversation with the patient, not the clinic owner, but actually the patient. Make sure you get approval for you to contact them by email or by phone. It is very picky. It's very tricky. But it's, as our college always says, it's not a problem until it is. And it only takes one. It only takes one complaint from a patient for it to go to the level of the college. So be really careful about who you're contacting and who your assistant is contacting. And then there's security. Do you want to authenticate two-factor authentication? If you're working with a virtual team, you need to think about this more than you would in office. You really need to make sure those passwords are protected. And so that two-factor authentication really does matter. Again, PIPEDA, HIPAA compliant methods, and make sure your team knows how to handle sensitive information in a very private way. And that's likely a dedicated space, a dedicated computer, no access to social media on that computer. So any questions about that, please let us know. But again, there's so many different regs across all the disciplines, like hundreds and hundreds of different variations. Tech stack. Okay, this is probably what everybody wants to hear. This is the fun list. So technology is here to stay. Since the pandemic, we have so many more options. People are more open to it, including our patients, but also our colleagues. So let's leverage it for our practices and for our personal lives. And let's make way more money and time with our families, period. So the first thing you need to do here is take an inventory of what you already have. So obviously, Jane app, check. Everybody here has that. So if it's working for you and you know that it's going to grow with you over time as you scale, beautiful. It gets to stay. Now, an old school fax machine, probably not. It can't be accessed remotely. So if you really take stock of the items you have and you have an old school fax machine that is not digital, it's probably time to upgrade. We can help you with that. Some of the companies that we recommend and are not affiliated with are SR Fax or Hello Fax for digital fax options, for example. But make sure you purchase a new option that is something that you can absolutely grow and scale with. So here are the top 5 tech pieces, other than that fax machine mentioned, that you need to consider now before bringing on a virtual team member. So another screenshot for you. If you want to take a screenshot here, this is probably the biggest, the best summary of the 5 things you need to have to start your virtual office. So phone. First of all, you will need a phone app or a phone answering service. So phone apps might be something like Google Voice. You might consider Zoom Phone or something like Grasshopper. Even TELUS and Bell and Rogers also offer phone app options. So what this allows you to do is it means that your team can log in remotely from their computer or from their own phone, and then they can call out to patients and the clinic number comes up in the caller ID bar. So patients will actually answer the phone because they think the clinic's phoning them. So this is the way of the future. Gone are the days of old school landlines without remote access. Gone are the days of sharing a cell phone. So if you have a cell phone or an iPhone and you're passing it like colleague to colleague, get rid of it. Get a phone app. It'll cost you like 20, 30 bucks a month. Everybody on the team can log in and use it if they want, or you can get different user access. It's awesome. It's really the way to go. Now, if you do need every single call answered every single time, you might consider a virtual receptionist. This is very different than your virtual assistant, but a virtual receptionist is like a pod or a call center. They're a group of people that will capture every call for you. We have lots of clients of ours that work very happily with Smile Dog. They're located in Halifax, and Smile Dog guarantees capturing almost every call of yours, and they integrate with Jane. And there's also a new option, Call Hero, that just launched by the amazing Rick Lau. And Rick is speaking at Jane Summer School as well about Call Hero. They integrate with Jane as well. So super awesome options. If you don't have a phone app, get a call service, otherwise known as a virtual receptionist. Now, email. Think about the patient-facing email that you want to give your assistant access to. So if you're getting personal emails to this email from your friends and you're using it for home use, and it's your name at gmail.com, it's probably time for an upgrade. So get a professional, practice-specific email with ideally with your practice's URL in it. And this is an email that's going to be entirely monitored by your assistant team. You also want to get a communication tool. So you might consider Google Chat, maybe Slack. I personally prefer Google Chat and our team uses it. I know that the Jane team loves Slack. There's so many different reasons to use both, and a lot of companies use both. So really great to have a communication tool. The benefit there is that it keeps things out of text. Text is not, well, text is not HIPAA compliant, but it's also not trackable. Google Chat and Slack, you can actually track the rooms or the hashtags. So it's really helpful. So it's instant like text, but it's trackable. And then it keeps everything out of the inbox. So that way you can keep your email inbox dedicated to patient inquiries and keep the team chatter in a totally separate place. And then project management tool. Not everybody's going to need this, but have a think about whether it suits you and your team. So the project management tools that we recommend are Asana, ClickUp, or Monday. If you're tracking projects, even little things like standard operating procedures, you might consider investing in a project management tool. They all vary. Their add-ons can really add up, and jack the price up. But just have a look at these three. If project-based work is something you've got your admin team doing, it's so much better than using a Google Doc checklist. So hear me out there. And then last but not least, I could have put this first. It's amazing. Jane tasking. It's gold. Now in the chat, can you say yes or no? Are you using Jane tasking already in your workflow? So are you using Jane tasking, not just for yourself? Yay, yes, no, 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 no. Yes, yes. Are you using it with your admin team? Yes or no? Oh, I think we're on the fence here. We've got like a lot of no's and sometimes. Okay, it might be. Now, typically when I talk to practitioners and they're not using Jane tasking, it's because they don't understand how amazing it is. So Jane task, on the bottom right of the patient's chart, you'll see a little message bubble icon, and you can toggle that over and create add task. So it looks like a note, but you can create it as a task. And this is the best way for you to communicate with your team members. And then it's trackable right on the patient's chart. So your admin assistant doesn't have to toggle between Google Chat and Slack and back to the patient's chart. It's all right there and it's totally tracked. So it's really great because it comes up for your team members as an itemized to-do list. And when they're done, they just click it and it's off. So I love it because it keeps it PIPEDA and HIPAA compliant because it's in the patient's chart. So if you haven't considered it, oh yay, thanks Ashley. Ashley put the link there. Have a look at the Jane tasking feature. It's truly gold. That's why it's listed as one of my top 5 things. Look, it's listed as important as email. So have a look there. Communication. Now this is a very important one, and it's the piece that most people find surprising when they hire their very first assistant. But 94% of problems in a business are systems driven. Only 6% of people driven are people driven. So what I mean by that is if you're complaining or a colleague of yours is complaining about how one of their team members didn't do the thing you asked, the only thing to ask yourself is, was there a due date? Did they have all the tools required? Were the expectations clearly outlined? And were you clear on the steps involved? So they didn't do the thing, but how did they know when to do it, how to do it, why to do it, and when it was due? So communication breakdown and poor systems, more on that shortly, often the root cause of a lot of workplace complaining. So we will be chatting about systems shortly. So for those of you who survived practicing during COVID breakdowns, or COVID lockdowns, excuse me, during COVID lockdowns, you probably saw a lot of communication breakdowns. Working with a virtual team requires a lot more intention. And I know there was a lot of chat amongst my naturopathic colleagues. They said the virtual team actually required a lot more effort. And I would challenge that. And I would say it's not that it's more effort, it's that it's more intentional. And so once you get the systems dialed, it actually becomes easier. It's just that you do have to be purposeful about it. So for example, you don't get to just walk by the front desk and throw out orders at the admin assistant in between patients. You actually have to book that Zoom call, meet your team one-on-one once a week. You maybe have to send them an email, or they have to send you an email every single day, or a chat message with their update on how their work went for the day. So 8 years ago at my clinic, I tried to implement a group meeting. I wanted to do case reviews, and I thought this was great. And there were only a couple of us that actually did this. We actually engaged. During COVID, when the clinic closed, we launched a Zoom get together for case reviews. And instead of once a month, we actually did it once a week. And we got so much great feedback. Everybody attends. We all share cases. We all actively engage every single Monday. And it's pretty awesome that taking it virtual made it easier and more fun for everybody. So everybody leaves that meeting feeling so supported. And we got eyeball to eyeball. We just weren't there in person. So it was actually easy. There was no commuting for anyone. So I'm a big fan of Zoom meetings. Now, we're all missing the water cooler talk, or as I like to call it, the hallway talk, because as a naturopathic doctor in an integrative clinic, so often I'll leave my office while I'm still in a patient consult, and I'll go grab a supplement off the shelf. And 9 times out of 10, I'll run by, or I'll walk by another one of my colleagues, and we'll have a little chit chat, maybe about the patient's case. I'll ask a question, or they'll ask me a question. Well, do you think that this is appropriate? Is there something else I should be thinking of? And it's so powerful. And we've always said, you have to work in a multidisciplinary clinic so that you get this hallway talk. But what I've learned is that you just have to intentionally create space for this conversation. So what we can do from a virtual sense is we can have team parties, lunches. You can have other team gatherings, or like a holiday dinner or a summer barbecue. You can do that all virtually, and you can do it really, really well. So now frequency. How often is too much, and how often is too little for communicating with your team? This is a big question. And honestly, it's never too much. It's always too little. So you can't over communicate with your team. Your team members, they want to hear from you. They want your feedback. They want to know how they're doing, and they want to be feeling like they're part of a community. So my suggestion, and our suggestion at Ginger Desk from our years of experience now, is that we call them alignment calls, but weekly touch points between practitioner and assistant, to really make sure that there's that dedicated time where the assistant has time to run through any obstacles they might have, or go through any expectations or goals for the practice for the following week. Honestly, though, if you don't meet with them, they will have no idea how to support you. So take home message with this point is meet with your team more often than not. And now managing expectations, write them out and share them with your team and say them out loud. If you don't tell them what your expectations are, they're not going to know. And if something goes sideways, if there's an issue, tell them now. It's different again when you see them in clinic and you can really read their body language. With a virtual team, you need to just nip it in the bud. If there's an issue, you get on a phone, get on a video call, and work that issue out right away before it becomes a bigger issue. So what's the best way to communicate? Email, phone, text, or video calls? You might want to sit down and really think about how this works for you, how this works for the clinic, how it works for your team. I don't suggest text. And actually at Ginger Desk, we have a no text rule. And it's because it's not trackable, like I said, about Slack and Google Chat. So it's not useful for later. My favorite way to connect with team members is through video calls. So once weekly video calls could be an effective strategy for you. And then, like I said, possibly end of day chat messages to just run through how the day went. And then there's walking meetings. So I'm a huge fan of walking meetings. They don't work for everyone, particularly if you're working on a project that requires you to be typing. But if it is that you're hashing out some details, relationship communication details, or just going through a one-on-one, this is awesome. Studies show that our cortex gets activated when we're in motion. All the physios know that. So when you're in motion, you'll be thinking more clearly. So get outside, go into nature, get your team member to go into nature and have a huddle on the phone. It's such a nice way to do it. Okay, workflow, and this is where we talk systems. So I loved what Nicole McCants said this morning about creating systems. And if you haven't watched her talk, go back and watch the recording. So good. Systems run the business and people run the systems. And then my favorite quote is actually the second one here. If you're too busy to build good systems, then you'll always be too busy. So take the time. Take the time. It's worth its weight in gold later. And a bad system will beat a good person every single time. I love these quotes. So whenever I meet a new practitioner, I ask them if they have an office manual, or as we call it at Ginger, a standard operating procedures manual, an SOP. 98% of the time, practitioners look at me with this super guilty face and they're like, I've been meaning to create one, but I'm so busy. And we get it. Nobody has the time. And that's why you're looking to outsource. Your zone of genius is not the minutia of admin tasks. Your zone of genius is healing the patient. It's reaching out to prospective patients, and it's writing a book or launching a course and really scaling the business of your dreams. And then you should also be taking time to perform wellness. So seeing practitioners yourself, but also exercising, visiting with family, and spending time with your friends. Too often, this is what we see. This is life before a virtual office. Practitioners think they can handle it all on their own. And in the end, everything sort of falls apart on them. Now, I want to show you a few case studies here. Case study number 1. This is a registered nurse, Kyla Phillips, that we've worked with for quite some time. She actually tried 5 different VA companies before starting with us. So a reminder here that it's not the person necessarily, it's the system. So she says here, at my consult call, we discussed all the different people she had been through. She knew our company was different. And then she did our onboarding package and was really excited about the systems that we employed in our onboarding package. And she knows now that to work successfully with a VA, you need systems and standards, and can't say enough about Ginger Desk. Thank you, Kyla. That's so lovely. And my next case study is from the amazing Dr. Caroline Coombs, naturopathic physician here in Vancouver. The dear Dr. Caroline says, working with Ginger Desk is quite possibly the best decision I've ever made for my practice. And I will say that Dr. Caroline worked for 10 years on her own, doing all her own admin. So she came completely from like ground zero. I adore my VA and I can rely on her to take care of the daily details so that I can focus on patient care. Together, we clarified my business goals and we're implementing a strategic plan to increase my revenue while improving my work-life balance. With the help of Ginger Desk, I've significantly increased my efficiency, and now I have a clear long-term vision for my practice, as well as the admin support I need to realize those goals. Awesome. So we surveyed our practitioners, and we found that 85% of practitioners found improved job satisfaction after launching their virtual office with us, and 70% of these practitioners enjoy improved energy management. So we are making a huge impact here at Ginger. I won't take too much time here. I know there's a bunch of questions we need to get through. I want to tell you about the amazing impact we're making here at Ginger. We are working to achieve 3 of the United Nations sustainability goals. 3.8, ensure healthy lives and promote well-being. 5.8, achieve gender equality. And 8.5, promote sustained, inclusive economic growth and decent work. And I'm going to show you how here. So 3.8, we're supporting practitioners and reducing their rates of burnout, which will lead in the end to better patient care. Our business model inherently is built to deliver services to remote and rural areas. We allow more practitioners to practice in these remote areas, resulting in improved access to patients. And we aim for goal 5.8 by supporting women and women identifying folks who are able to nurture and grow their families while also advancing their careers. Women represent 70% of primary family caregivers. Most job opportunities don't allow enough flex for these workers to succeed in their careers. Women in our company don't have to choose between either staying home with the kids or gaining valuable career experience to move up the ladder. They can do both, and they can do both well. And we also support goal 8 by offering decent work and economic growth. So by empowering employees to thrive, we offer a living wage, flexible schedules that support wellness, remote work, employee stock options, employee health benefits. We provide paid on-the-job training and career advancement opportunities. We believe so strongly in our values, and we operate in every way by asking first, how does this decision impact our values? Which value does this decision breach? Or which value does this decision honor? So I'll remind you again to know your values for your team to thrive. Thank you so, so much. And now we will take questions, if we have any left here.
Wow, Dr. Julie. Well, first of all, I mean, I'm not seeing any questions. I would encourage anybody who has any outstanding to pop them into the chat right now. My head is spinning though. There's a couple of things that I absolutely really appreciate. So the idea that communication breakdown being a problem with system and not people, it makes so much sense when you say it, right? And I can tell that that actually connected for a lot of people, because the reasons why you explained, you know, were the expectations clearly outlined? Was there a due date? Did they have all the tools required? Were you clear on the steps involved? Wow, I mean, that makes perfect sense. So I really appreciate you mentioning that. The other thing that really is mind-blowing is the idea of having virtual meetings outside.
Yes, in the forest.
It never occurred to me in the 2.5 years that we've been remote that I could actually take a call and go for a walk at the exact same time. So I'm like, wow, this is really going to change my day, to be honest.
I love it. I love it. That's
and
awesome.
I recall like reading your blog. You mentioned that part of what you were thinking came in the forest, that you're actually walking and developing the plan for Ginger.
Yeah.
Surrounded by nature.
It all happens in the forest. That's where all the great ideas come from, because I think we're finally less stressed and so much more connected.
I love that. All right. Are there any questions?
There are a couple. If you're barely out of school and have 4 clients a week, yeah, we do have a package for you. We have our packages start at $349 a month for a VA who works Monday to Friday, 8:30 to 5:30 in your time zone. And we would check in once or twice a day if you've only got 4 patients a week. And that means they would hear back from someone really, really regularly. And you can contact us at hello@gingerdesk.com to meet directly with me to learn more. Customized nutrition programs. How can Ginger training a VA for my business? I'm not sure I understand the question, Kirk. Can you, I offer customized nutrition programs. We work with practitioners who support all kinds of different things, and we'll work with you to create a workflow that makes sense for your practice. We handle the invoicing, the bookings, your email, and outgoing phone calls for you. So if that's something that you need with those nutrition programs, absolutely, we can support you.
And are there any geographic constraints, Dr. Julie?
We work all over Canada and the US. So all of our employees are employees of Ginger Desk, and they're all Canadian employees. But we do serve practitioners all across the US. So we're across all time zones in Canada and the US. Sorry, Australia and the UK will come to you eventually. Awesome. What would the steps be? From 100% in clinic, you would be interested in a hybrid. This is all new and kind of hard to understand. Totally. There's a lot to think about when you're launching your virtual clinic. I mean, the top 5 things I recommended there under the tech stack are the most critical things that you need to put into place immediately. And then from there, everything will play out. You just need to create an operations manual as you play your systems out.
All right, excellent. I think we're running into time. So I really wanted to thank you for
Thanks, Ashley.
wearing your values on your sleeve as you're explaining this. It's actually been wonderful to go through that. If anybody has any questions or wants to follow up, they can reach you at hello@gingerdesk.com. So definitely encourage everybody to do that. And as I mentioned at the beginning, there will be a recording of this session and it'll be available very soon. So thank you everybody for joining. And I hope you take part in more Ally. Thank you very much.
Thanks, everybody.